welcome Shari Stamps to the We Got You Mama Summit. We're so happy that you've joined us. And you are joining us from
Northern California, kind
Northern
of
California.
between San Francisco and Sacramento.
Awesome. So you're like, I grew up in Seattle, so that's like our weather is very like same. Cool. So you are a baby and parent wellness practitioner. I got
Yeah.
that right. Baby and parent wellness practitioner, because she has practice and expertise in a million different things. And I want you to share kind of your journey into this space and all the different things that you focus on, and the kind of people you work with, and then we'll launch it to some things that really resonated with me when I learned about Shari. So tell us
Awesome.
all about you. People are sick of hearing my voice over and over, so we're just
I'm
gonna
sure they're
take
not.
over.
Um, yeah, so I was in the content and editorial space and multimedia and all of that. I got my bachelor's in creative writing and associates in journalism. I worked for magazines and online websites and stuff. And I had my 13-year-old, and I was like, I want a website for parents, and I didn't like writing about um like actors and their kids and like following, all that stuff. Like that's the
Yes,
type of place I
yes,
was working for at the time. I was like, I don't really care about celebrities. I want to write about like parenting stuff.
yeah.
So, and at the time, blogging was kind of changing, and I was like, wait, I originally looked down on it because, I came from this editorial space, and at the time blogging was like, here's my day, here's my personal diary. But it was changing. I was like, I can just make my own website. So I made my own parenting lifestyle website, and it was based, on my daughter, who was Savannah at the time, so it was Savvy Every Day. And then there was another shift where it was like, you need to have more than a website. You need to have some sort of product. So I was going to create a
Mm,
course for parents, like the hospital course, only like both parents could actually attend, and it could be virtual. So I was like, I need to come from a place of expertise. I was pregnant with my now 7-year-old. And so I went to train as a birth doula so that I could do this whole like newborn parent course from a place of expertise.
mhm,
And during that training, I learned a lot for my own birth and for this course I was going to do. And I learned about postpartum doulas, and I learned about perinatal mood and anxiety or disorders just a little bit. And I learned about how I've been suffering with it um, since having my 13-year-old. And I had seen therapists for different things, talk to them, like talk, trying to get somebody who understood, like, this isn't me. I know it's not. I don't know what's wrong with me, and nobody pinpointed that.
mm.
And so to be able to put a name to it was really huge. And then that was a completely different birth experience than my 13-year-old. With her, I had the package. I was in my 20s. I didn't look pregnant after I gave birth to her. Even though I had the package, everything was fine. With him, I gained like the most weight I'd ever gained. And I had an extremely fast natural birth. And I had shakes, I had chills and sweats and all these things and these aches and pains I didn't understand. And I went back into the ER after giving birth to him, spent all day with like them probing and doing internal ultrasounds, not what you want when you just out of birth, like a fast birth.
Yeah,
Um, for them to say at the end of the day, like, oh, this is just natural stuff from having a fast birth. And I was like, this is nuts. Like, this is night and day from, like you would think my natural birth, everything would be wonderful, it'd be better than the other time. But I was
yeah,
older. They had like a 6-year difference. Um, and I wasn't expecting all this stuff in postpartum. No one told me that this could happen.
yeah.
Um, so I was like, okay, instead of focusing on the other course I was going to do, I need to do something about postpartum. So I trained as a postpartum doula, and I created a postpartum prep program that included like IBCLCs, baby-led sleep experts, other doulas and stuff. And it's like really comprehensive. Um, and it's about preparing while you're still pregnant, which is a concept people didn't quite grasp. But now there's more, you see more of that now. More people are starting to pick up the whole postpartum prep concept, which is awesome.
Yeah.
But from there, it kind of dominoed. You learn about one thing, and then in that training, you learn about something else. So then I learned about, I can't remember if it was infant massage first, or I was already in a lactation educator counselor training. Um, but I think it was, I think it was infant massage. I trained in infant massage, and then I was pregnant again, and I was like, well, let's do this lactation educator training because I love
Why not?
breastfeeding my babies, and I'm one of those extended breastfeeders. Um, yeah, why not add it to my portfolio? Because, here I am helping parents, and usually they need this lactation support,
Yeah.
or feeding support. It doesn't have to be that they're necessarily body feeding. Um, and so while taking this training, I was learning about torticollis, and I looked down at my daughter, and I'm like, oh, wow, she has it. And so then I was able to advocate for her to go see a pediatric PT for torticollis because otherwise my pediatrician wasn't going to notice it.
Yeah.
Um, yeah, so it's just been kind of like not only the trainings leading me on this rabbit hole of more trainings, but my children, like with each kiddo I have, I'm like, oh, there's this. My 13-year-old could have had a tenon lip tie, but I didn't know about it then. And with my now 7-year-old, the doula happened to mention, oh, I think he has a little tenon lip tie. So I had his released, but I didn't know about all the other work you're supposed to do with it. And then same with my now 5-year-old. Then I had infant massage training and I had some lactation training. So I did a little bit more, but there was still so many missing pieces. And
Yeah.
then when my 2.5-year-old was born, by then I had my even more training. And since then, I've trained as a baby-led sleep and well-being specialist in craniosacral therapy in like multiple levels because there's more than one class you take.
Hmm.
I've trained in the infant frenectomy protocol from Dr. Chelsea Pinto, and then I've held my own oral tie summit with Dr. Gigi, and I've also done another postpartum doula course, and then I am a certified breastfeeding specialist. Like I've done all these extra training since then. So with my now 2.5-year-old, I was able to do a little bit more. And then even since him, now I'm like able to help families even more. It's like, oh, these were all the
Yeah.
pieces I was missing. And
Yeah.
I see a difference in, the 3 kids, the ones that I didn't know, hey, you're supposed to do all this other stuff
Right.
versus this one who was like, okay, I got to do a little bit more with you, but still not everything that I know now. That's you.
Hmm.
And yeah, and each as I'm learning stuff, it's just all unraveling, and I'm like, this is connected to this, and I've been looking into primitive reflexes and neurology, and really everything is connected. And so
Yeah.
to me, it's essential that I know lactation and body work care and the development and all these other things across the lifespan and especially in pregnancy because it starts there.
Yeah.
My whole thing is postpartum begins while you're still expecting
Yeah.
and you're still pregnant after you give birth to your baby because there's that fourth trimester.
Hmm.
So I try to wrap people's minds around that.
Yeah.
And everything in pregnancy sets you up for postpartum, and
Yeah.
it sets your baby up for their development
Yeah.
because how they're positioned and all that stuff, it affects everything. So, yeah, it's a lot. And so I just tell people I'm a baby and parent wellness practitioner. I look at the whole picture, find root causes. There's
Oh,
more
yeah.
to it than just, oh, your baby has a tie, let's do this snip and then you'll be good.
Right.
The ton is connected through the deep front line all the way down to your feet. So it
What?
affects the whole body. Yeah. And that's
Okay,
something
let's talk
people don't
about
know.
that. That's fascinating because that's what happened with me. I was in the hospital and I was like, this is, I mean, I felt like destroyed every time. Each breastfeeding journey in the beginning was super rough for me. And I did notice that when he started crying and I was like, oh, my friend had that and she told me about it. And then she said she wasn't able to like ever nurse and latch properly because she didn't catch it early. And I was like, so it was on my mind. And so I mentioned it. And then they had someone, doctor guy, come in and was like, oh, just do a little snip. I'm like, great, snip it. Great. And things I think were okay. I don't know. I don't know. I'm probably going to learn from you. They weren't okay. And here's why. And maybe I'll like,
Yeah.
I'm going to have 20,000 aha moments, but yeah, 3 kids
I,
here too, 13 and 11 and 7. And, this was my middle, so my 11-year-old. So same thing. You're like, oh, I got this. This is whatever. I'm like, this is different. This is, he was different and every babies are. And so, that's why I've always been, have
yes.
also been really encouraging second, third time moms, like come to the summit. You're going to learn different things. You don't know
Yes.
second time, third time around, if these babies will be different, the carrying the baby will be different, the birthing will be different, and then the
Yep.
babies are all different. So
Every
tell me
baby is
about
different, their own
all
person,
that.
and every birth experience is
Yeah.
different. Therefore, every postpartum experience is
Yeah.
different.
Yeah.
And then if you have a second or third child, you didn't have a second or,
Right.
you didn't have those other children before when you had your first. And
Yeah.
then we have updates and like safety measures and all this, it's
Yeah.
different. One of the trainings I did was newborn mothers, and I love that term because you are a newborn parent every time. You
Yes.
are going through this transition every time. You're a very new person each time. Because yeah, now you have more kids.
Mm-hmm.
And this birth was different, and you're a different age. And there's so many factors in your life that are different. It's not the same environment. It's not like,
Right. Yeah.
yeah.
Yeah. So tell me, I'm just like, yeah, yeah, totally. And then like when you say you've learned more with each kid, I'm like, be in this process and talking to all these wonderful moms and experts, I've been like, I should have a fourth because I'd be killing it. I'd be killing it with my fourth kid because I know like so much more. But also the reason, you know, we do what we do, right? To bring people into this, all knowing all the things and then feeling empowered in all
Yes.
the things, I think is important.
Yeah.
So I would love to get more into, just so the mom out there that's pregnant or realize something is going on, the whole tongue tie situation. What does that look like? What are the signs to look for? And what is the proper measures someone takes to get it handled?
So, first of all, I don't want someone to feel guilty like, oh, this is all my fault. There's a lot, we're still unclear about where tongue ties come from.
Yeah.
I mean, we kind of know it's genetic. If another kid had it, the next one probably will. You probably have one, which you may realize as time goes on, kind of like how a lot of parents are realizing, oh, hey, I might be autistic, as they go through this journey with their kid as they get
Sure.
evaluated.
Yeah.
Um, and it could be there's some different theories that we have more folic acid in all of our food, which is not a natural form of folate. And those of
Mhm.
us with like this certain gene cannot tolerate it well. There's like you know, concepts where they're like, oh, it's the development, or it's just happens because of genetics, or it happens because of our food supply these days, so many theories,
Mm.
but they are not new. I know there's some like articles this past year that really brought up a lot of like suspicion around the evaluation of tenolip ties and like, oh, it's just a money grabber.
Mm.
But if you search online, there's images of midwives using their fingernails to cut
Mm.
tongue ties from like, I
That's
don't know if it was the
fun.
1900s or 1700s, but it was a long time ago.
Yeah.
And I'm like, oh, I
Ugh.
can't see how that would, I mean, it'd have to be really good.
Just your motion of like just getting in there and
Just
using your
like
finger. I'm like,
sweeping like that. I'm like, oh,
okay.
doesn't sound
So
fun. But
they've been recognizing it and like
yeah,
doing something
since
about it forever.
it's
Okay.
just like everything else right now with the depression rates, anxiety in children, it's
Yeah.
exponential. Like we're noticing it more, and
Right.
there should be more research about why is all this happening right now? Like what
Mm-hmm.
do we need to change? But aside from that, it's something to be aware of ahead of time when you have your baby. If latching is not going well, they're not like doing a real nice open mouth latch.
Mm-hmm.
There are a lot of symptoms to tongue and lip ties, but it doesn't necessarily mean it's a tongue and lip tie. You need
Okay.
to, so here's some symptoms that could be it, but they could be something else. Could be lip blisters. It could be they can't extend their tongue, but they can also still extend their tongue, so you never know. You know, cheeks are not incorporated. You might notice that their head, if they have like a head preference, everyone has a head preference, but if it's like they're really not turning, if they have a lot of gas and reflux, these
Mm-hmm.
are all symptoms of a tongue tie, but don't necessarily mean tongue tie. There could be other things going on too.
Yeah.
Um, And so if you start noticing some things like that, they always have white on their tongue and it's not thrush. That's
Mm.
called milk tongue because their tongue can't reach the roof of their mouth to clean,
Like clean. Oh, okay. Yeah.
Yeah. So if you're seeing some of those signs paired with them not, always choking, gagging at the breasts,
Mm-hmm.
dripping milk, um, then it's like, okay, let's go see a frenulum specialist. Usually they're a dentist who is trained in oral ties. A lot of people tend to go to the pediatrician. And unfortunately, we kind of put this pressure on pediatricians and OBs to be like, you must know everything. You're the baby
Sure.
doctor, you're the pregnancy doctor. They don't,
Yeah.
this is a specialty. So some pediatricians may feel like they have to give an answer, or like instead of just saying, this isn't my area, I'm referring out, they'll be like, no, you're fine. Or, oh, it'll stretch out, just keep breastfeeding or something. And that's
Mm,
not the case.
mm.
So what you want to do is work with a IBCLC who is trained in oral ties, because if they aren't, they're not going to help you in a good way.
Okay.
And you want to find a craniosacral therapist because you need to work on releasing the tension in the body, because, as I said, the tongue is connected down to the feet. And you want to find the frenulum specialist. Some frenulum specialists will be like, oh, we can do it today, which is why I say seek out the lactation care and the body work first, because you
Okay.
want to be working on that tension. So that way, if they say, yes, this is a tie, because only the frenulum specialist can diagnose that. Like the
Mm.
rest of us can, if we've been trained in it, say, I think it might be something you should have them look at, but only they can diagnose. Um,
But that's pretty, I mean, that's pretty common practice too. Like if you see their frenulum like attached like at the tip of your tongue and
Oh,
you're
yeah, at
literally
the
an
tip,
expert,
there's no denying that.
right? Like you'd be
Yeah,
like, yeah,
they
you
can't move
should,
their tongue.
let's look
Yeah.
into that. And I just remember being in the hospital and like that, you know, was never brought up or she didn't look or you know what I mean? And it
Oh,
was
yeah,
me
that's
just
a
having
severe.
known. And it was pretty clear, I thought, especially when they cry and you're like, that's not that's,
Yeah.
um
But there's a
and
thing called faux ties too, where people will
yeah,
go, they got the snip, or if you see a frenulum specialist, they use a laser now, which I personally prefer. But there's pros and cons to lasers,
sure.
and like if you go through your medical insurance and you see an ENT, they do what they call snip, where it's a cut.
Yeah, that's
Um,
what my son got.
So that's another thing you need to look into. Do I have a frenulum specialist who's a DDS trained in this field near me?
Mm,
Or is an ENT my only resource? And like, do I want to travel for one or the other? You have to look
yeah.
into your pros and cons. Because you want to make sure that when they do actually do a release, if that's needed, they do a complete one.
Mhm.
And, because your frenulum is normal in your mouth and it's going to reattach, but you want it to reattach in an optimal position, which means you have to
Yeah.
continue wound care, but it also means you have to do other things to rehabilitate, just like if you broke your foot or your knee or you broke your hand.
Yeah.
And you're like, how do I learn to write with this hand? If you've never used it to write with before. So these babies don't know how to use their tongue or incorporate their cheeks or all these different muscles.
Yeah.
And so they need the assistance of not just the wound care, which people tend to think is all they need. They think of that as the exercises. But then the IBCLC will give you more exercises based on your infant's reflexes that they already do at their age and stage,
Mhm.
and to help get the tongue moving and get things like incorporated so that you can have a good latch. And this is important even if you're not breastfeeding, because it will affect, like your example where they couldn't lift their tongue because the tie was right at the tip of the mouth. They
Yeah.
can't eat solids or even purees,
Yeah.
puree type solids, and it affects speech. And then because it's connected down to the feet, it's affecting the crawl, which affects like how the body integrates, which affects your brain, and then behavior things later, and learning to read and write and all of this. So it's like it affects more than you think.
Yeah.
Um,
Can it affect like colic and stuff if it was like
yes,
done wrong?
because if
No.
you're if you're all tight and if they're not eating well, they may
Yeah.
have like aphasia where they're getting like a lot of air in and
Yeah.
getting like a lot of gas in their stomach.
Mhm.
Um, and they're like, oh, it's colic. They'll grow out of it. Okay, but in the meantime, they're in pain. They're in
Yeah.
pain. Have you ever had indigestion or like
Yeah.
this giant gas bubble, and you can
My
do all
poor
the infant
son was
massage,
like,
but it's still there.
yeah, he was so sad. He was just so sad. And like, that's hard. If anyone's had a colicky baby, it's so hard. I
Oh
had to
yeah.
hire a babysitter. that was experienced with colic because she just come off a summer watching her nephew who had colic. So she was fine with like, he's fine. He's going to be screaming and crying. And I had to just leave. And I was like, lie to me when I get back and tell me he wasn't screaming the whole time just
Yeah.
to keep some sort of sanity. So you're saying that if he was clipped wrong or something like that could affect how he ate and digested and like could kind of
That, but also if you didn't do
potentially been
body
a
work,
part of his
which
colic.
it sounds like you didn't know about. So
Oh,
because, so we have fascia all throughout our body. It's in between our muscles and bones, and it looks kind of like a sticky spider web.
yeah.
And it is kind of like a spider web catches the flies and stuff. It kind of catches, like, let's say someone scared you and you're like, oh, you
Yeah.
kind of tense up and then you kind of relax again. That's the fascia in our body kind of protecting us. Or you're in a car accident, or something very emotional happens to you. You're you feel it physically, you
Hmm.
tighten, you
Yeah.
tense. That's our fascia, and it tenses up to protect us as an innate instinct, but it doesn't know how to like necessarily release. So you could have tight fascia in one part of your body and it's affecting another part of your body because there's certain pathways where the fascia connects, like, up here, down in your pelvis, your knees, your ankles, it all connects. And then there's different like straight pathways, like the one I mentioned, the front line where it connects down from your tongue to your feet. So you add the fact that this baby was developing with this oral tie to possibly a traumatic birth experience, if there were forceps used that compressed anything in their head, there's going to be fascial tightness in so many places in the
Mhm.
body. And so that's why it's important to see a craniosacral therapist. And I also believe in, like, some people are like, well, I like my pediatric chiropractor. Great, see them too, but they do different things, very
Mm,
different. Just like a massage therapist is something different than a chiropractor.
sure. Yeah.
Um, so I think it's fantastic to have many modalities that are helping you. Like, I'll tell people, okay, at this point, I want to keep working with you for CST, but see a pediatric PT because I want you to tell your doctor what's going on and get that referral, because that's a whole nother space, at that point.
Yeah.
And I think the more support you have, the better. And I tell people, this is what your village is. People are always like, where is the village that they say I'm supposed to have? Well, in 2024, it's the village that you create.
Mhm.
It's the village of your care team to support you. Because there's no like free volunteers that are just like, that's their job to like come around people here, at least in the US. So it's the village you create, and you need to, that's why I feel like it's so important while you're still pregnant, create that in advance if you can, because you need emotional support, especially if you have a colic baby
Yeah.
and you're dealing with that. They co-regulate. And so if you're upset, they're even more upset,
Yeah.
and they feel it, when moms are dealing with depression or anxiety, the baby gets that high cortisol and it affects them too. And then it's like this horrible, like, round and round and round.
Yeah.
So, I've kind of digressed a little bit and I have to remember what I was talking about. But, yeah, so the craniosacral therapist can release some of that tension. So that way, when they get the ton or lip tie, or if you have a provider who does the buckles, because I've seen those be very tight and affect things still. Um,
Where are the buckles?
that's usually like kind of almost, it's to the side, like
Okay.
right here.
Yeah.
It's not really the cheeks so much. Some people will say that, but it's, up here and down here or over here. And that's like, people don't think of it as affecting as much because it's not the restricting the tongue, it's not restricting right here for
It's
food,
all
but it's
connected.
along the sides.
Yeah.
And so it used to be sometimes they would release the buckles. Now they're like, well, we don't release the buckles. It really depends on who you talk to.
Hmm.
Everyone has their own thing.
Yeah.
And then again, aside from looking at the symptoms of the tie, you have to look at the function. Okay, I'm seeing these symptoms, how is it affecting function? And now let's look at the actual tie, because you could see a frenulum specialist who's like, I see a tie, but I'm not seeing any symptoms or function issues, so I think we should leave it alone.
Yeah.
So there's a lot to think about and look at. You have to look
Hmm.
at getting the body work done. So that way, if it is a tie and they release it, they're not clipping or lasering, muscle. So it's a
Right.
thinner frenulum for them to work with so that even
Yeah.
a midwife could do it with her nail. Um, and that, leads to better healing because it's, you cut what was supposed to be cut,
Right.
or lasered. Um, and then so it's getting that body work first, making sure you're working with a lactation professional because sometimes it actually isn't an oral tie. It's the tension that's creating symptoms that look like a tie. So it
Okay.
can prevent you from needing that procedure, but
Yeah.
also it can help prepare you for a like better outcome in that procedure. And then you get the procedure, and then the hard part, believe it or not, is all the work afterward because some people are like, oh, I only need to do 4 weeks of wound care. Or I only need to do 6 weeks of wound care, depending on, what they're told.
I don't think I
But
even
you
heard the word
also
wound.
need to do all the exercises.
Yeah.
And then as a craniosacral therapist too, I'll tell people, and I want you to do this, this, and this. I have even more exercises for them, oral exercises and body exercises, because it's all connected. And they have to keep, doing that and watch for things. And
Yeah.
uh,
So that can
uh,
also launch into like gas. You all hear, oh, the baby's so gassy, or we're really gonna pump his legs. Like I was like queen of mama's bliss.
oh yeah, gas drops.
Yes,
Yeah.
like I
So
was like swore by them. I would dip her binky in it. She's like, and then it would like you'd hear it gurgle through and she'd release. And so I was like all about all the gas drops, but it was just kind of like relieving what was going on. I don't think
yeah.
I was, dealing with the root cause at all.
Yeah, because in that case it could be they needed more help incorporating their cheeks and building up the strength of their cheeks to make sure that was like a good seal. Maybe there was a little lower jaw, the lower jaw needed to come forward. I'm forgetting words. Um and there's a lot of other stuff that we kind of have to look at beyond
Yeah,
just taking away the tongue or lip tie. And
yeah,
so that's why having this whole team that's looking at it from different angles to help you is important. And sometimes, I mean, you get the tongue and lip tie released and it's like, oh, their gas went away. Oh, this is wonderful. And then it reattaches like in a not great way. And you
mm,
notice the symptoms come back, but differently because it's a different attachment. And you
yeah,
have to get it, released again. And that's when it's like, well, if you had been working with IBCLC the whole time, checking for
yeah.
that, and the body worker, like they could have been helping. You could have been doing these other exercises too, and that would help with the gas also, because you wouldn't have more air coming in and you wouldn't have that tension that's causing that buildup and all these other things.
That's crazy. Oh my gosh, he would have been such a happier baby if I had you in my life.
Well, I didn't know about this stuff even
If I had
2.5 years
someone
ago.
like you in my life at that
Yeah.
time to tell me what's up. Yeah,
Yeah, it's
fascinating though. It's a
like
lot,
each
but it's just to know that, and this is kind of what I keep repeating, that like they're answers to your questions. And like if you feel like something's off or not right, or and maybe you hear like, oh, it's normal, oh, it's newborn, it's just colic, they'll grow out of it. Like just know that, like, trust your gut and be like, no, something's off. I need
yes.
support. And like you said, like if you can build that village beforehand and just have access to people, or know who to call, or know, if your pediatrician has a referral list, you know what I mean? Like just get those things set
Yeah.
up so that if it comes up and your gut, or you're like, oh, I think I heard something, but maybe it might be this, you can ask someone that can then, inform you. And
And it's hard. I mean, 100% trust your gut and don't ever
yeah,
feel like, well, this might be a stupid question. Oh, I'm a new parent, or I should know better. I'm trained in, like, I've had those moments. I'm like, I'm trained in this, but I'm going to ask anyway because it's better to ask than
yeah,
be like prideful and like I shouldn't ask because I'm embarrassed or whatever.
um,
And unfortunately, a lot of times it can take years to find like the right person who has the right knowledge to just tell you something so simple. You're
yeah,
like, why didn't someone tell me this 5 years ago? And
yeah,
that is what bugs me. And that's what I'm trying
yeah,
to like eliminate because
yeah. You
it's
shouldn't have to
there's
suffer through it.
I'm like, which gatekeeper do I need to find to get this like simple thing that it's like once I know it, there's all this information online, like, but I'm
Yeah,
just missing, those little words. that's what's frustrating. And I wish that we could prevent parents from going through that and searching for answers for years.
Yeah. Yeah. That's so amazing.
You know?
I'm just thinking about I can't stop thinking about my screaming little tiny little
Oh my
boy. And
gosh.
like, all you want to do is all you want to do is like solve it. You just want to make
Right.
everything better. And you're just in the throes. And it was, your second kid. So there's also a toddler running around. And so they're not the only focus. And what's cool is so many of these practitioners, of these care specialists, of these IBCLCs, they come in to the home, which I think is a huge relief as well,
Yes.
right? Think about getting out the door with a toddler and a newborn, and you're like, I'll just suffer through because that's like, I can't right now,
And the
And
number of
um,
appointments you have as a new parent, it's
yeah,
like,
yeah,
I mean, I know I need to go.
yeah.
It's
But
trying
to
to get
have those
there.
appointments even set up, and these people in line before baby comes, that way it's just there, and then you'll know and you'll have the answers whether you think you need them or not. Right, you're someone in there to
Yeah.
help you support you, and so that if you have questions, like, oh, well, she's coming tomorrow, so then maybe my nipple's not going to be completely destroyed if I'm trying this for 3-4 days, right? That
Yes.
was me. I can't, and then things got kind of solved. But having that appointment, even that
And
discussion, yeah.
finding the people that come into your home, like you mentioned, I know in Southern California, there are some amazing providers who go in home,
Yeah.
um, which is just like, yes, there was Dr. Tracy uh, Tran, I believe, was going in home. I don't know if she still does that for clients for the release procedure. And
Mm,
she, like years ago, she would bring an IBCLC with her. And I'm like, that's just
oh,
amazing.
yeah.
Like everyone else, I drive an hour to the provider who I like, and
Yeah.
people they come from out of state to see this provider too.
Mm,
Imagine that having to like get on an airplane and stay at a hotel, all of that to try to get this help.
yeah.
But there's massage therapists because you're gonna teach you some TLC, they'll go in home, you know, postpartum doulas, IBCLCs, private practice, they'll go in home, um, breastfeeding specialists like me or CLC, it's just another different certification. They'll go in home. Um, there's some CSTs, like I was going in home, but now I'm due with a baby number 6 soon. So I'm like, you can come to my office now. Um, yeah, so there's options out there.
Yeah.
You just have to like research them, weigh them, and just because they come in home, like, well, if there's someone who's like a little bit better trained that you doesn't come in home, maybe you want to go with them, and you have so many pros and cons lists to look at, and so that you don't overwhelm yourself, it's good to start researching now.
Yeah. Yeah. 100%. And that world online can be really overwhelming, but look at the reviews. Ask people, start joining those Facebook mom groups. You know what I mean? Like those didn't exist
Yes.
when my babies were little. So it's like get referral. Like people are like, oh, I don't have mom friends yet. And it's like, well, you can get into spaces and communities even online and start creating mom friends. Like, hey, I'm pregnant and I would love to start building. And then people will be like, oh my gosh, I'm obsessed with this person because da, da, da. And they will, moms love to share all the things, good
Oh
and
yeah.
bad, that they went
Oh
through.
yeah. They'll tell you everything.
Yeah.
My caveat to that is Um, please don't go into a mom's group going like, I like 3 or 4 months postpartum is usually when I see these posts about like, I'm losing my supply. I don't know what to do. And everyone posts like, try this cookie, try this
Oh,
lactation
yeah,
drink. And
no.
I'm like, please see a craniosacral therapist and a lactation like specialist consultant because there can be other things going on.
Yeah.
And
No, you
people
need
on the
someone
internet
that,
have not seen your baby. They don't
yeah,
know your medical history. Like there's so much more to it than just
yeah,
like it could be you need a hydration boost. So I will say that, please, like for stuff that you think might be like, oh, I can ask the hive mind what worked for them. You are
right.
not them. You are you and you're a unique person. Your
Yeah,
baby is a unique person. So what worked for Tabitha, might give you an allergic reaction or make your supply
right.
worse.
Yes,
Um,
100%. Yeah.
but definitely for referrals and recommendations, I think it's wonderful.
Yeah.
Like for who to, where can I find help and
Yeah, and call them up and then go with your gut. Who do you resonate with? Who do you 100%.
Yeah.
I think that's key. And something we've obviously been like really driving home is create that village.
Yeah.
Create
Go
it
on
how
a
you want it to be. And like, here's some people and here's some advice. And all of us are saying, like, here's some information and empower yourself to, yes, learn all the things. Try not to go down too many rabbit holes, like I thought I read all the books and was ready for anything. And it's like, I feel like I read all the books on pregnancy and maybe bringing a baby into the world, but then right? So like I would have,
and that's the other thing. It's like we tend to think like, oh, it's a book. It must be
it must have
like a
all
trusted
the information.
resource, but anybody can publish a book, right? And it could be
Especially
like,
now, like, let's be honest,
yeah.
especially now, it's
But
just like
but
even
even
self-help.
before, there's a lot of like
Yeah,
trusted parenting books, and
yeah,
it's like really outdated stuff, and they tell you things like it's fact, but then if you look at the actual studies, you're like, this is not a
not
true
true.
study. Like this would not pass high school like biology.
Yeah,
Like what?
yeah.
This is from
And
like the
so people
40s or
that are up to
50s.
date, I love that, up to date in their information. Like we had a pelvic floor therapist come and speak to our Village of Moms at class, and it was interesting because someone was like, well, my pediatrician told me this and this and this. And she goes, who's your pediatrician? And she was like, because it's a community where she went to this, right? They all know each other. And she was like, yeah, she's very old and she doesn't update herself on current practices and new research and science and like,
Yeah,
right. And so she's like, so she's telling you something that she's been telling her patients for the past 45 years, which
yes.
maybe that's
Like
all they knew 40 years ago.
the oatmeal in the bottle or rice in the bottle. I still see moms in Facebook groups going, "How do I do this? My pediatrician said I could." And I'm like, "What? No." Or like, "Oh, my pediatrician gave me the okay to start solids now that my baby's 4 months." And I'm like, "Ah, your pediatrician is not a nutritionist. Like,
Yeah.
please don't."
Yeah.
So it's another one of those where it's like I feel like you think, well, they're supposed to be the baby doctor, but they don't know, they get like 10 hours of lactation education,
Right.
whereas like I've taken
Yeah.
hundreds upon hundreds.
Right. And it's not a place where we blame them because I think we're like, oh, we're so
No,
mad that they don't know
it's
all the things and they should be trained in all the things. And it's like,
but
that's
they
what our
shouldn't. They're
systems
one
are in.
person, but they
Yeah.
they should be able to say that's not my specialty, which I think that
Refer out.
pediatricians could be better at, but I feel like we put that pressure on them to know everything, and that's not fair to pediatricians.
Yeah.
And pediatricians often are in like a medical system where they have patient after patient
Right.
after
Yeah.
patient.
We've talked a
How
lot
can you
about
get
this too.
anything done by the time that, the end of the day happens? They don't have time for like the passion projects of taking like these new
Yeah.
courses and updating stuff like those of us in private practice have, because we have fewer patients and they have back to back, like it's hard.
It is hard. You have
It's
a
a
time
very rough
constraint, you have a
schedule.
certain amount of people. Yeah. And
Yeah.
it's been fascinating because we have a couple of doctors, pediatricians in our summit that we get to hear from and learn from, and they couldn't handle not being able to spend enough time with their patients. So they're like, they went out on their own and they started doing in home, or they started their own practice where they're
That's
like,
amazing.
oh yeah, our consultations are like an hour and we address all the things, and then another
Yep.
was like, I needed to learn more about um breastfeeding, and so they got their certification so they can come in the home and they can treat this, but also like if you need medicine they can write prescription, you know what I mean? So it's very
That's
cool how
amazing.
we're kind of seeing that start to happen a little bit.
Yes. I
And I
just
can
wish
only,
that it was affordable to
yeah,
people because
yeah,
I mean, I think they can still, since they're a pediatrician, bill, but like since I'm not a
yeah,
doctor or RN or whatever, I can't bill insurance. They can use health
yeah,
savings for me, but it's out of pocket. So
yeah,
that is like a prohibitive
yeah,
factor. But it's like I spend an hour with you. Actually,
yeah,
sometimes I have a client who had an hour appointment, but then she was here for 2 hours. I'm like, thank
right,
goodness I didn't have anyone after her.
right. And that happens, yeah.
Because
And it's
you become a
interesting, like,
therapist and
yeah.
everything else. Yeah.
And I keep saying, like, I hope that we're building a world in which, like, maybe my daughter, that this will be common practice and insurance will cover it. You know what I mean? That we'll have enough support for these moms where you're getting everything you need to thrive.
Yeah.
Um, yeah. So like we mentioned, save up for it, put these services on your list, on your registration, see if someone is, certified, but also maybe does some pro bono work or even is on a sliding scale. And there are certain states that are popping up with like insurance covering certain things or covering
Yes.
75%. So like do the research.
Doulas.
Don't just assume. I assumed that I can't afford that. Like I don't, and I had a horrible experience with my lactation expert that came in. And so then that like put a bad taste in my mouth with that expert. But you
Mhm.
can't blame one person for not,
And that's
that's
difficult
why you
because
talk to
it's,
someone beforehand and know beforehand. Because I'm in the throes and I'm like, I think I know my baby, and she's telling me this. I'm like, that's not gonna happen. That's not gonna. And then she's like, I've never met a baby that did not. I was like, well, I told you it wasn't gonna happen because we spent too long, like whatever. And then it was just like I'm crying and like my mother-in-law's spying in, and I'm like, I can't. This is like it was just like out of a reality freak show. It was so horrible. But had I known that maybe this is something I would need support in, right? I could have like done this with a couple people and like, nailed down some support in my life so I wasn't in that
yeah.
state when it was like when everything's a mess, right?
And that's a really good point too. Like you have to advocate for yourself and for your
Yeah.
baby
Yeah.
and know it's okay. Like you can fire your pediatrician, you can fire IBCLC,
Yeah.
get a different one. If
Yeah.
they're making you feel uncomfortable or like your questions are stupid
Yeah.
or they're not listening to you,
Yeah.
you know, it's such a rough period. Like you said, you're in the throes of
Yeah.
everything and you're very hormonal and sensitive.
Yes.
Um, but you do know your baby best. You may
Yeah.
not know like all the stuff that they've trained in and researched, but if you have a gut
Yeah.
feeling and they're dismissing you,
Yeah.
find someone else because not the nobody has the same training across the board,
Yeah.
which we've discussed. So it's
Yeah.
like if that's not the right pediatrician for you, find a different one. If
Right.
that's not the right IBCLC for you, like I've actually had clients who've seen like three different IBCLCs and they weren't
Yeah.
great. And then I helped them with something and it's sad to hear that.
Right.
Um,
But we're
but
all
it
human.
happens.
Yeah, we're all human, and
Yeah.
and maybe that person would I mean, because that person was great for my pediatricians. I'm like, cool, I'm getting my pediatrician's lactation expert. And
Yeah.
that was not great. It
Yeah,
was
because you're a different
tough.
person too
And a
from your
different baby.
pediatrician. You had
Yeah.
different needs. And
Yeah.
then
But also
there
like her last baby was like 10 years prior. And so, right. Like, so that person might not even be, anyway. Yeah. That's a whole
yeah. And
thing.
then
But
also you need to be able to
yeah.
vibe with them because we all have different personalities. Like I may
Yeah.
not be someone's cup of tea, and they might like somebody else who like is more reserved and doesn't just kind of talk about everything with
Right.
them. So, make sure you're comfortable with your care team.
Yeah.
That's your care team,
And if
and
someone comes into your house that, wants to support you and be part of your care team, should also say that. Like, we got to vibe, we got to be down. And if you're not, that's totally fine. I could send, I can refer some other people that are great and I think that's really important too, just to know that, like, hey, we're here to support you however you need to. If I'm your person, great. If not, like, you do you. Like, don't
yeah,
feel like, and there was another, Summer who owns Summer Sleep Secrets, and she trains and certifies people in various fields. And she was like, yeah, no, I sit down with them. I'm like, if you want to go with this other gal that just left, she's like, you have to, like, here's what I offer. And then this is what she offered. We're very different and we go about things in different ways. So it's whatever you as a team of parents, want to do. You
yeah,
just let me know.
because
Yeah.
you don't want to
That's
be
great.
working with someone
No.
who, especially in postpartum, there are parents who will like smile and nod at stuff and then complain about, oh, I didn't like this person. And it could be nitpicky stuff because you're hormonal. It could
Right.
be you just don't like that person. It's like you should have just told them from the beginning, especially if it's a postpartum doula or someone coming in your home.
Right.
You don't have to shower and get dolled up or clean your house for them to come.
No.
They know what they're gonna see there.
Yeah.
Be comfortable,
Yeah.
but also be honest with them because
Yeah.
they can't give you the best care if you're not telling them honestly, like, hey, could you maybe do this instead? Hey, we have
Right.
a no shoes rule in our house. Like, tell them up
Yeah.
front so they have they know what they're supposed to be doing
Right.
instead of you being like, oh, I don't want to be rude. And then you're like really upset about stuff that you never
Right.
expressed.
Right.
So that's important too.
Communicate, communicate, communicate.
Yeah, communicate open, like you're paying them, be honest. They're
Yeah.
there to help you.
Yeah.
And then if even with that you don't mesh well, they're not the right person for you. They don't want to work in an environment where they feel like scrutinized, and you don't want to feel
Sure.
that you
Yeah.
don't want someone in an environment who you feel like is not supporting you
Yeah.
properly. So
Yeah.
it's definitely important both ways.
Yeah. I love that. Well, if people want to work with you or reach out to you or have questions or concerns and, want some referrals on, you name it.
Yeah.
Why don't you, we'll have all the information in the email and stuff, but why don't you just shout out where they can find you, how they can get in touch, if they want to reach out.
Yeah, so I'm navigating parenthood on Instagram, TikTok, Pinterest. Navigatingparenthood.com is my website. And yeah, Shari at navigatingparenthood.com is my email. So feel free to reach out any of those places. I don't know everything, which I think it would be a red flag if someone said they did, but
Yeah.
I can try to help you and like refer you to who I might think might
Yeah.
know.
She
Um,
knows a lot. And she's on her sixth kid, y'all. She's on her
yeah.
sixth kid. So, she's been through it. She's in the throes. I love. When are you due?
June, it's supposed to be June 16th, but I don't know. This one's got me guessing. I'm like, is it now? So we'll see. They're already 6 pounds and I'm 34 weeks. So
Okay.
yeah, we'll see.
Final stretch. Final
Yes.
stretch. Well, I'm going to vote for the 9th. That's my birthday, June 9th,
I
not May 9th.
I am thinking June 9th, if not May. That
Okay.
is what we're thinking right now.
All
So
right.
we'll see.
Well, I'm excited to see the new bundle. So exciting. Well, thank you, Shari, so much for joining us. We really appreciate all that awesome information. And again, reach out if you have any questions, concerns. She'll guide you in the right direction. I really feel that. So thank you. Thank you for all you do. Thank you for all the support that you offer moms and babies and parents. I think the more that we support all our moms and educate them, and the more that these experts, continue to educate themselves, right? And then share that information, I just think, yeah, the more supported and stronger we'll be in this community. So thank you, thank you, thank you. I
Thank
really,
you. Thank you so much for having me and
all
hosting
right.
this and yeah, letting me come on and
Of
talk.
course. And we'll see you back again. This is not the end. We're gonna do plenty of these. And next one, you're gonna have I want to see that little tiny baby. Oh, I love the babies. Well, congratulations again on number 6. And yeah, we'll chat again soon. Thanks for joining us. We'll see
Great.
you.
Thank you.
Bye.
Bye.